Good afternoon, everyone. I think we can start now. I'll introduce myself first, and then I will introduce the doctor today. My name is Haya Mer'i, and I work at Friends of Cancer Patients. Um, and we're delighted to be working again this month with Shalhoub in this very important initiative. As we know, November is internationally known as Prostate Month, and it is a very important cancer that targets men, and we will go through the details now. We'll talk about prostate and testicular as we focus on both through our campaign. Friends of Cancer Patients have been working with Shalhoub across different programs that we do to raise awareness about early detection. And we value this partnership, and hopefully we will continue working together and raising awareness on this important cause. It will be my pleasure to introduce Dr. Salam, who will be going through the presentation and explaining more information about those two cancers. And if you guys have any questions or any concerns, please either type them in the chat, or at the end we will open it up for anyone for if they have any concerns. We are also recording this, so if anyone wants the recording later to go through the information, or if they want the presentation, please feel free to ask myself or maybe Megan, and we will share it with you guys. So Dr. Salam, if you can kindly start.
Yeah. Hi, salam alaikum. Thank you, Haya. Do you hear me, Haya?
Yes, it's clear.
Yeah, hi. Good morning, everybody. I hope this will be the last November that will be virtual. Hopefully next year will be in person with you after we finish this pandemic. I'm Salam Al-Hassani. I'm consultant urologist. As Haya said, today we'll speak about two main diseases affecting men. Or mainly will concentrate on cancers, as being these are cancers can lead to the death, but at the same time it is highly preventable cancers and can save our lives. As you know, Shanab is coming from Shanab, which means the mustache, and is a male cancer awareness initiatives started by Friends of Cancer Patients, and this is mainly will concentrate on two cancers in the men, as I said in the beginning, which are the testicles and the prostate. Just a short note that Friends of Cancer Patients being founded in 1999 in Sharjah, United Arab Emirates, and it is it is directed by Her Highness Sheikha Jawahar bint Muhammad Al Qasimi, and it was really great initiatives. And I can tell you as a doctor, and we see a lot of patients being saved by this charity institute, and it's committed to help cancer patients and their families financially and morally. On one of the main missions that to start raise the awareness about cancer. Before I personally, I can tell you, I see in my grandmother saying they call it the things that we cannot tell, because they're afraid even to mention the name of cancer because we'll give a bad luck. Now we can say the cancer because there are a lot of modalities to treat or even to prevent some cancers. Unfortunately, we cannot prevent all cancers, but we can say we can prevent some cancers, or at least we'll go for early detection of this cancer, we'll go for a complete cure of that disease. As you see here, cancer is no longer a personal problem. The rising rate of cancer incidence because of a lot of changes happen in life. We can say from the waves, from mobile phones, from exposure to chemicals, and all these could lead to an increase in the rising rate of cancer incidence, as Her Highness Sheikh Jawahar bin Muhammad Al Qasimi said. From this, Friends of Cancer Patients have been initiated a program, they call it Kashif, which is in Arabic means detection, or actually kashf is, if you go for proper translation, is early detection, for mainly targeted for the cancer. For it started with the breast cancer, then in childhood cancers, including blood cancers and other cancers, and also the skin cancers and the men's health, which are, as we will speak about today, in prostate and testicular cancer. Shanap is, as we said, means the mustache, and it is started since November 2014. And here we are targeting a wide range group of men, as the testicular cancer can start from as early as 15, and even I can say, if they allow me, even can start earlier than 15 years of age. And the prostate cancer can start above 50. Now, unfortunately, because of changes in the lifestyle and other changes, we are seeing a prostate cancer earlier than 50 years. We said again, we are concentrating on the prostate and testicular cancer. And this will work into different stakeholders within the UAE. To start with, everybody knows cancer is uncontrolled. Exactly, is uncontrolled growth of the cells, which is usually these are abnormal cells and lead to spread. See, in human body, not all the cells or the tissues are the same. You see in the skin, for example, if you injure your finger, you will see that it will grow again and there will be healing. Without growth, controlled growth, then this healing will never happen. You see on your daily activities, when you go for cleaning of your skin and this one, so a lot of dead skin will go away and the new skin will come out, including in the stomach also, and the gastrointestinal system. A lot of this, if you go for sperm production, it is part of proliferation, but all this will be under a control, proper control by a human body, and a lot of signals being responsible for controlling of this growth. If this growth away from normal control, it will become a cancerous cells, and these cancerous cells will go for rapid proliferation, and then will go for we call it metastasis, when it start to spread in different parts of the body and lead to further effect. It depends on the cancer where it will be. We'll start with the testicular cancer. As we said in the beginning, it's mainly targeting the young age group, in 15 and even less, and 35 years. It's unlikely to be found above the age of 35, and usually when we find the cancer after testicular cancer above the age above 35, is most commonly we call it secondary, means that it's coming from another place and being stayed inside the testicles. And the testicular cancer usually it will be started in the testis itself, and as you know, the testis is just outside the body in the scrotal sac, and God actually make the testis outside the body because for protection of spermatogenesis or production of sperms, and we need to have a temperature about 1 degree centigrade less than the body temperature to have a normal proliferation of the cells and production of the sperms. If the testis will come inside the body, will have the same body temperature, this will lead to the death of these cells. And this is what will happen for people who have, if you heard about it, especially the kids, we call it undescended testis, or in Arabic they call it al-khasya al-hajira, means that this testis didn't go properly in the scrotal sac and lead to death in this testicle if it is not treated in a proper time. In the testis, we have different types of cells. We call it, there are germ cells, which are responsible about the production of the sperms and the hormone, which is the testosterone, and there are non-germ cells. But most of the tumors will be arising from the germ cells, because as we said in the beginning, the germ cells are in continuous division and proliferation and renewal. because it's responsible about production of hormones and production of sperms. If there is any by any chance this growth or proliferation will go wrong, then will lead to the cancer cells. And the good news here, I can tell you with high confidence, with the new advances in surgeries and technology and chemotherapy, radiotherapy, and other early detection modalities and technologies, testicular cancer, if you diagnose it early, it is 100% curable. See, it is 100% curable, and you can live all of your life normally if you're being diagnosed at proper time. And at the same time can lead to death if it is not diagnosed at a proper time. As you see in this slide, it's around 50,000 of new cases being diagnosed and 10,000 of death. I think these figures are a bit old figures, because now I think the death rates with the more awareness, with the more technology and more availability of medical health, that this death from testicular cancer will becoming less and less, and I can say definitely it's less. This is why we want to go for early detection, and early detection will lead to early treatment and lead to the complete cure. 100% cure of the testicular cancer is possible if you diagnose in a proper time. In general, we have 5 most common cancer can be diagnosed in men. You see the colorectal cancer, and after the colorectal cancer is the prostate cancer. See, prostate cancer is the second most common cancer in the men, and followed by the leukemia, bronchus, and urinary bladder. So in urology, actually, we can say the one on the top 5, we have a bladder cancer, and we have the urinary, prostate and urinary bladder cancer. And I think, inshallah, Haya is hearing me, that in the future, maybe it will be a good idea to add, in part of the awareness is to add a bladder cancer. Now, if you go back to testicular cancer and see who is at risk, in general, any man is at risk. Any man is at risk, and especially young age group. Again, why it is in young age group? Because this is the group where they have rapid proliferation of the cells with rapid production of sperms and hormones. So at this stage is an important stage for age group can lead to a testicular cancer. But any man still at a risk of cancer. But there are factors that increase that risk. One of them, that what we said, what we call it undescended testis, or when there will be delay in the descent of the testis from the inside the body into the scrotum, and can lead to what we call it undescended testis, because it will be at a higher temperature, and this will affect the proliferation of, in addition to affecting fertility, also we keep the patient at a higher risk of testicular cancer. Just to keep in your mind also, these people, even if they want, after treating and putting these testes in the normal position in the scrotum, still they need to go for more frequent checkup, because still they are at a higher risk than other age group. Or other people, because who have normally descended testes from the beginning. There are some genes can running in the family. So the people who has previous history of testicular cancers, they and can run on the same gene in the family and being at a high risk. For any reason, when there is any abnormal development in the testicle, atrophy of the testicle, we call it intrauterine maldevelopment, and could this lead to some hormonal changes, and these people are at a risk of cancer. I can add to that, actually, still it is not approved, but there are a lot of articles saying that even when you put your mobile phone is next to your testicle in the bucket, because of the signals, is keeping also increasing the risk of testicular cancer. I can say it is not proven, but there are some articles supporting this idea. So we can say it's better to keep it away, not to put it on the pocket next to the testicle. See, in most of the things that bring the patients to the doctor and asking for the help of or medical advice, in most of the cases, is the pain. Unfortunately, is the main symptoms of testicular cancer is hard, painless. So there is no pain in this testicle. But most of the people, when they come, my patients, when they come here, unfortunately, they say it happily that I don't have pain, but my testicle getting bigger. They feel that this is a good sign. Unfortunately, it's opposite. When the patient sitting in front of me and telling me that I have enlargement of the testicle without pain, this made me more worried than when he said has pain. So hard, painless enlargement or lump in the testicle is the main sign. And it could be diagnosed incidentally for a patient who's going for any other reason, for trauma, or a patient going for fertility evaluation, and by ultrasound we found that it has some enlargement or a mass inside the testicle. Usually it's not only the testicle itself, it's usually there will be some fluid around this testicle will getting an increase inside, and what we call it the hydrocele, or in Arabic al-qila al-ma'iyya, which means that there is some more fluid around the testis, and because of the tumor lead to higher secretion of this fluid. Then at this point the patient start to feel having heaviness or dragging pain because of increasing weight of the testicle. And usually this is not an early sign. When the patient starts to have backache, means we are reaching to advanced disease. When the patient starts to have soreness or even breast enlargement, means that we are starting to have more advanced disease. This is this is the stage that we don't want to see, and I can say, fortunately, we are rarely seeing these cases because of I can say, from the efforts of people like friends of cancer patients, Haya and her colleagues, that are doing a great job for awareness, so patients coming are much earlier than this stage. So what shall we do? You do, and I do, and everybody will do for early detail for the intervention for testicular cancer. First of all, we have to put in our aim that we need to have early detection of that cancer. And early detection, we need to, by what we call it self-examination. We'll go for that, I think, in the next slide. And whenever it's being diagnosed, usually we'll go for a clinical examination, simple ultrasound, one blood test. And once the diagnosis is being confirmed, we'll go for a surgery to clear that cancer. Then accordingly, I can tell you, in most of, if you diagnosed early, till here, the treatment is finished. Remove the tumor and usually finish. But if it is a bit delayed in the diagnosis, then we may need chemotherapy or radiotherapy. It depends on the histology or type of the cancer. And still, even till that stage, we can achieve 100% cure from testicular cancer. But only in some cases, when we have, we call it stage 4, which is mean metastasis spreading all over the body, that the mortality will be increased, and the disease can be incurable. What to do for early detection? Now, actually, the international guidelines advice is to go for once a month, not every day, because then you cannot differentiate. So keep it as a once a month. Let's say every first Friday of that month, every whatever. Put a date for you, put it in your calendar, put it in your phone, that today is the day for my self-examination. And this is what you do it when you are taking a shower. You need to go for examining each testicle separately. Usually the testicle, it depends, there are different sizes, depending on the age group, it depends on the genetic factors from ethnic group. There are so many different sizes, but always don't, you will see that both testicles are not of the same size and not on the same level. Most of the time, usually the left is lower than the right side, and this is all or normal. It depends on the cord length. And you need to feel it. You feel the skin, you feel the testicle. You need to use both hands, because you need to use, unfortunately we are not in physically there to show you, but you need to hold it like you're holding an egg, and then with the hold it to fix it in one hand, the other hand you will just palpate all over the testicle, and to see if there is any abnormal feelings or hardness in that part. And this is mostly for the men who's in, as we said, in the age between 15 and 35, of course, plus minus. Whenever you see that there is anything abnormal, then it doesn't mean to need to be panic. I can tell you in most of these cases, because we are seeing a patient coming to that, not due to cancer. Most of these cases is due to something we call it a chronic infection or inflammation in them, maybe in the epididymis, which is the cord next to the testis, or the testis itself. And is usually we need a few days of some medicine and it will resolve. Not necessarily is a tumor, but it's always good to have a look and feel it. And I think it's easier if you can, if unfortunately, as we said, we cannot be in person to show you exactly with the models that the people they have in Shana program, they have a nice models to show how to do examination. You can open on YouTube and you can see it, how to do that. Okay, I think this is, we covered that. Okay, I think we finished with the testicular cancer. I don't know, Haya, shall we proceed for the next, or keep the question till end, or we have question from now?
I think we can keep the questions till end since no one has typed anything yet. So yeah, let's move towards prostate.
Okay. So I think we'll move for prostate cancer. And just to start with, the prostate gland is very important gland, which is, I can show you here maybe. Okay, the prostate gland is, I don't know if this will be clear or not. I hope it will be clear. It seems not. Yeah. So here is the prostate. As you see, this is the bladder, which is the one which is up, and the one which is down here is the prostate. The prostate, which is the organ, the gland, which is just below the bladder, and is part of the urethra. You see the whole urethra coming through the prostate. So any disease in the prostate and can affecting the urine flow. Also, the prostate is very important organ, which is responsible about the production about 35% of the seminal fluid. So when there is any disease in the prostate, will lead to also problem in the fertility and the sexual part. So it is a combined organ. So any disease affecting the prostate can lead to the urination problem and sexual problem. And it could be part also of some fertility issues when a patient, especially in young age group. So, in prostate cancer, as we said, if you remember in the beginning, is the second most common cancer in men. So, early detection will lead to the better survival. And the early detection of prostate cancer usually will save the lives, because we have curable modalities of treatment. We'll go to that. This, as we said, the prostatic gland is a part of reproductive system, and as you see here, this is the prostate, and this is the bladder here, and this is the urethra will come in here, and they will come out. Also, if you see there's a small ducts here, this is where the semen will come inside through the prostate into the urethra, and then to go out through it. So it is important organ, and it is in very critical, actually, position. So if there's any enlargement here, it lead to the compression of the flow, so the urine will not come properly. Usually the size of normal prostate is in a walnut size, but can reach as big as the tennis ball. We can reach as big as a tennis ball with the progression of the age. There is no specific symptoms for prostate cancer, and prostate cancer also can be asymptomatic. But in general, we have three main diseases can affecting the prostate. There is one, we call it the infection of the prostate or prostatitis. The other one is the benign prostatic enlargement, which is the most common, and this can happen in the any man in the middle age and elderly because of part of aging process that will lead to the enlargement of the prostate. And the third one is the prostate cancer. Usually the symptoms of all three are the same. And the only way to detect this is a cancer or not cancer is by doing our screening program by 2 or 3 tests. In general, the symptoms will be urinary frequency, means the patient will need to go to rush to washroom more frequent than usual. Let's say you are holding the urine for every 4 hours, then you will start going every 1 hour or half an hour. The urine stream will be very slow, so you need to take a long time to pass urine and can lead to painful urination, or sometimes you see blood or semen in the urine or in the semen. And impotence usually is a late, when we say there's impotence due to cancer. I'm not saying, because you have to be very careful here. Doesn't mean that any man above the age of 50 who has impotence that he has a prostate cancer. No, impotence can be for any other reason, but in late stages of prostate cancer also can lead to impotence. And this when the patient will start to have metastatic disease. But impotence in 99% of the cases is not due to prostate cancer, due to other diseases, whether due to part of aging, hormonal, or diabetes, or blood pressure changes, or whatever. What are the risk factors? The age is a risk factor. So when you progress in your age, you're being at a higher risk of having a prostate cancer. And we'll go to that when we will start for having screening for the prostate cancer. And usually African American people are at a higher risk than Caucasian, or even we can see here for us in the Middle East, we are in the middle risk group, not like the people in Far East, like in Japan and other parts. Their risk of prostate cancer is extremely low, while in North America, and whether in Canada or state, the risk of prostate cancer is higher than Europe is coming after that, and we are coming after Europe in the risk of prostate cancer. But unfortunately, again, now the risk is increasing because of changes in the lifestyle. Family history. When we have any patients who have said that he has a father, a grandfather who has history of prostate cancer, this will keep the patient at a higher risk. And we'll see, I will let you know exactly what this will make the changes in the screening. Diet, I mean, most of the patients, they will ask, what shall I do for diet? What is the best diet for prostate cancer? The answer simply will be, we'll go for that in more details, but the answer simply, you have to keep on healthy diet. Healthy diets means healthy diet for the prostate, increasing vegetables, less fat, and mainly the animal fat, less protein, less saturated fat, and more or fruits, and we'll go for other specific food. Yes. So what you will do for early detection, as we said, by symptoms, we cannot rely on, we cannot wait for the symptoms. If you wait for the symptoms, you are waiting for a late stage. The early detection by simple test, which is a blood test, and the PS, which is the PSA or prostatic specific antigen, and by physical examination, and your doctor will decide if he needs to do the digital rectal examination, or even now with the advances in the scan, we may need to go for what we call a digital transrectal ultrasound to look for the prostate properly if there is any mass or any suspicious lesion could be seen there, especially when we feel it by finger, there is anything detection. When I don't know if they put it here. Yeah, the question, when shall we start doing that? See, you see that you start in 40 years or 50 years, or it's if any patient who has a strong family history of prostate cancer usually will start as early as 40. Okay, for detection of a prostate cancer. This is based on the guidelines. And if the patient has no risk, is not from the risk group, doesn't carry the genes for prostate cancer, and he's not from African American, or he's not having any strong family history of prostate cancer, usually started at the age of 50, and in most of the cases will be on annual base, and it depends on the initial result that your doctor will have from the PSA and rectal examination can give you the advice to do it on annual base or less frequent, let's say every 2 years or every 5 years. It depends from patient to patient, depends on the risk factors. What shall we do? We have all of us to quit smoking today, because it's not only risk actually of prostate cancer. I can tell you it's a very high risk of bladder cancer. And I can't, unfortunately, we will lose one of fan or on famous people very soon because of his heavy smoker and having a prostate cancer being diagnosed at later stage. And the weight, you need always to keep ourselves on the average weight. Is obesity is a risk factor, but at the same time should not be to be cachexia, because you will have more deficiency of significant nutrients. So you need to keep your weight in a healthy weight. And how to keep it that? With having a healthy diet, regular exercise on regular basis. Most of the patients, they said, yes, I'm doing exercise. What you will do, I'm walking in and around, going to the mall. This is not an exercise. Exercise, you need to have, you be dedicated. Exercise, you need to have at least 60 minutes continuously of moderate exercise, whether jogging, running, or any other, swimming, cycling, any other activity. This is the real exercise, not to walking around. And this is it's better than nothing, but this is not the real exercise. And you need to have healthy food, and the healthy food will be focused on as it is here in the diet. You need to have balanced diet with the vegetables, fruits and vegetables, and lower intake of red meat and any type of canned foods. You need, because of the preservative there can lead to high risk. Decrease the amount of protein as much as possible as you can. And tomatoes, it's very simple. Tomatoes, and it always will, because of the lycopene is there in tomatoes, it's proven actually give you some protection of a prostate cancer. And tomatoes, especially the cooked tomatoes, because this lycopene in the cooked tomatoes will be 100 times than fresh tomatoes, in addition to watermelon and grapefruit, especially the red one. And we need to avoid sugar. You need to have high fiber diets, because this is all, as we said, it's all healthy food. You need to keep yourself healthy with the healthy food, and not only for gastrointestinal or colon cancer, also for prostate cancer. In summary, for intervention for men cancer, is that early detection is the key. Whenever you have early detection, you have the, just to let you know, before that, the prostate cancer, whenever you detect it early, you can treat the patient by doing nothing, by the way. You can treat the patient by doing nothing, just to keep them, observing them, but you need to keep them under monitoring, or to do by surgery, which is removal of the radical prostatectomy, removal of the prostate, which can be done by open laparoscopic or robotic method. And you can have some sort of radiation, to kill that cancer cells, in addition to a lot of new modalities. But these are other modalities, if you hear it about it, whether by laser modality or ultrasound energy, these are still not proven scientifically to treat prostate cancer. The only proven is surgery, and radiotherapy is proven to can kill the cancer and treat it completely. And chemotherapy, of course, especially for the testicular cancer, and less likely for prostate cancer. And high dose chemotherapy and the stem cell transplant. And this is actually promising therapy for the cancer. And thank you very much for your presence. And I'm ready to take any question. I hope it was that beneficial for you.
Thank you, Doctor. It was a really lovely presentation.
Thank you.
Thank you. So, if does anyone have any questions or any concerns that they would like to ask? Hmm. Okay, I'm presuming there are no questions.
Okay.
Okay, so from my side, I would just like, maybe some guidance. So, just like as a final message, just so people don't get scared. So, just as a reference, in general, when do you think a person, should do their full checkup? At a certain age, or is there a certain thing that you think would, as just a general doctor recommendation?
So you are asking me, Haya?
Yes, I'm
Yeah.
asking you.
see, it depends here. It depends on the age, as we said in the beginning, and what we are looking for. And if you, and for the man, also is different from the woman. For the man, if you are telling about prostate, he has to go for, if he has a family history of a prostate cancer, or he's being from African American people, or they have some specific gene can transfer. Even, see, by the way, we can say family history of cancer is not necessarily prostate cancer. From the female side, if they have breast or ovarian cancer in the family, again, he has to go from the age of 40, because the gene is the same and can transfer between the family to the male side. These people need to go for from the age of 40. And the prostate cancer, you have to go for your doctor, because you need to do blood tests, you need to do physical examination. For testicular cancer, you can start it by yourself, and not only by, most of the people here, maybe they pass this stage. I don't know about the age of the people, but if they are past this stage, you have to transfer this message to your sons, to your brothers, that they need to go for monthly, not every day, not every week. Is a monthly checkup for the scrotum, and to see if there is anything abnormal. Then you go for asking for help if there is anything abnormal. So these are, if we are speaking about the prostate and testicular, because if we want to go for a colon or a bladder cancer, the colon will have a different protocol. Now it's also above the age of 45. You have to go for checkup. If you go for the lung, actually, it depends on people who are smoking or people. I can stay away from that, because it's you put it as a bladder cancer. Now I have one of my patients. Imagine the age is 30 years, but he has a very aggressive high-grade bladder cancer. Why? Because he's working in an institute. He exposed to, I cannot say, was that exposed to chemicals. So also this is need to be looked at. So if he, where are you working? Is office job, or you are exposing to specific chemicals, then it will keep you at a higher risk of some cancer. So it's a good idea. In general, all the health, they are saying you can do twice a year health checkup, and you can raise all these issues to your doctor, your family doctor, asking him, what shall I do, which cancer I need to go for in my age for screening. A family doctor usually will guide you, will tell you, here you need to go to the urologist, here you need to go to gastroenterologist, here you need to go for orthopedic doctor. Yeah, it's accordingly for the female side. If there are any other female other than you, so then you can ask you to go to gynae, breast physician, to do which test accordingly. But usually, at least we have to have twice a year annual checkup.
That is good to know, and I think it's an information important for people to realize that you shouldn't leave things to the last minute when there's a problem. Don't go diagnose a problem, but more of a early detection screening. That each year, just put it in your calendar that this date I have a appointment with my either my general family doctor. Just do this annual checkup, and I think this is a really important message. Thank you, doctor, because we have a tendency to leave. All our issues to like there's a problem and then we
I
go.
told you, hey, I just said in the beginning, that we heard before that in some houses they said the disease that we cannot tell, huh? Right?
Yes.
I, they afraid even to mention cancer because we'll give you a bad luck. No, it's not like that. And another message actually, please. Some people they said I don't want to go to the doctor because they keep on digging till they find something. Let them find something to treat if they not necessarily, because sometimes you find something you don't need to treat, but at least you know that you have it. But if you have something you have to treat, and this is why if you compare the life expectancy actually in people in Canada, for example, and our life expectancy now, even the WHO, they changed. Before we said till age of 50, 50 to 70 is the middle age, and above 70 is the elderly age group. Now, I think it will come officially very soon. The WHO changing this because the life expectancy is increased. They want to make till 100, till 70, sorry, is a middle age group. Sorry, till 100 is middle age group, and above 100 to make an elderly age group, because there are people living healthy up until age of 100 if they are doing the proper checkup and the proper screening.
That's amazing news to hear. Thank you for that information. I actually did not know about it. It's very interesting. Okay. I think there are no more questions. Thank you, doctor, so much for this. And if we
Thank
do
you.
receive any other questions later on, I'll definitely forward them to you.
Okay.
Thank you so much, and thank you
Thank,
everyone for attending. Hopefully, this was insightful, and hopefully, we will meet. Next time when Shalhoub and us have an opportunity to work together. And thank you so much. Thank you, everyone. Thank you.
thank you.
Thank you, Dr.
Thank you.
Master. Bye.
It's awesome.